Understanding the scope of practice is one of the most testable and important areas on the PCA Personal Care Aide exam. This lesson clearly defines what you are allowed and not allowed to do as a PCA under the law and agency policies. This knowledge protects the patient's health and your job as a caregiver. What is scope of practice of a PCA? The scope of practice is the official list of duties and tasks that a PCA is legally and ethically allowed to perform. It is not based on what you're personally comfortable doing, but on what your training and the law allow. Staying within your scope is essential to avoid harming the patient, prevent legal consequences, work safely under supervision. You must never perform tasks outside your job role, even if a patient or family member asks you to. What PCAs can do, which means authorized duties. Personal care aides are trained to assist clients with daily living needs, support their safety, and promote dignity. Here are core duties within a PCA's scope. 1. Personal hygiene assistance. Bathing, bed baths, sponge baths. Brushing hair and teeth. Shaving with electric razors. Grooming and dressing. 2. Mobility and positioning. Helping clients transfer, like bed to chair, etc., turning and repositioning bedridden patients, ambulation assistance such as walking with walker or cane. 3. Elimination support assisting with toileting or use of bedpans, urinals, helping with incontinent care, emptying catheter drainage bags, but not inserting or removing catheters. 4. Nutrition assistance, preparing light meals, feeding clients who cannot feed themselves, recording food and fluid intake if required. 5. Environmental tasks, light housekeeping such as laundry, dishes, making bed, tidying up living areas, maintaining a clean, safe environment. 6. Observational duties, monitoring for skin changes, mood, or behavior changes, reporting any unusual findings to the nurse or supervisor, recording care activities accurately, like charting. What PCAs cannot do, which are prohibited actions. You are not a nurse or a medical technician. Some tasks are strictly off-limits, even if you feel capable or a client asks you. These are the key prohibited tasks. 1. No medication administration. PCAs cannot give any medications, including prescription or over-the-counter meds, creams, eye drops, or insulin, even vitamins or herbal remedies. Exception. Some states may allow it if specifically trained and delegated by a nurse. Check local rules. 2. No sterile procedures. PCAs cannot handle open wounds, dressings, or perform sterile techniques. 3. No catheter or medical device care. PCAs cannot insert, irrigate, or remove catheters, cannot handle feeding tubes, oxygen setups, or IVs. 4. No invasive care. You may assist with toileting, but you cannot perform enemas or suppositories. No finger sticks for blood sugar unless explicitly trained and delegated. 5. No clinical judgments or diagnoses. PCAs do not make decisions about care plans, treatments, or symptoms. You must report concerns, not treat them. 6. No handling of client finances or legal documents. Cannot write checks, manage money, or sign anything on behalf of a client. This protects both you and the client from liability. When in doubt, what to do? If you're ever unsure whether a task is within your scope, stop. Don't guess. Check your training materials and care plan. Contact your supervisor, RN, or case manager. Tip for the test. Always select the answer that shows you understand when to seek guidance from a nurse or refuse to perform tasks that are not in your training. Let's have a quick recap and things you need to remember. The scope of practice outlines what a PCA can legally do and what they must not do. You are expected to know these boundaries for the PCA certification exam. Key tasks include helping with hygiene, mobility, nutrition, and daily living support. Never administer medication, perform sterile or invasive procedures, or make clinical decisions. Always report anything unusual to your supervisor. Understanding and respecting your role keeps both you and your client safe and will help you pass your PCA exam with confidence.